Good afternoon, everyone. My name is Kelly Hall. I'm the Senior Director for Healthcare Transformation and Innovation at the Health Policy Commission. And I'm delighted to be here today to moderate what I hope will be a really fantastic discussion on a subject that seems extremely timely in this moment, achieving equity in telehealth access. We have a great panel today, so I don't want to delay too much before introducing them and getting going. But let me just provide a little bit of context to set the stage for the conversation to come. I think we would probably agree that one of the few unintended benefits of the COVID-19 pandemic has been the real-time, real-world experiment we've experienced in what widespread adoption of telemedicine could look like. On one hand, I think few would argue that the presence of telemedicine has really been a lifesaver at a time when people's abilities to visit their providers in person was so strictly limited. But before we jump with both feet into a telehealth-enabled future, I think it's worth pausing to ask, who's being left behind? Is telemedicine really solving longstanding inequities in healthcare, or simply reinforcing existing barriers, or perhaps even introducing new ones? And if it's the latter, how do we course correct sooner rather than later? So we have, as I mentioned, we have a terrific panel today. I'd love to introduce them, beginning with Dr. Lee Park, who's the Senior Medical Director for Quality and Patient Experience for Digital Health at the Mass General Brigham System. Dr. Madeline Aviles Hernandez, who's the Outpatient Services Director at the Gandara Center. For those of you who might not be familiar, the Gandara Center provides residential mental health, substance abuse, and preventative services for children, adults, and families across the Pioneer Valley and in Eastern Massachusetts. We also have David Darkangelo, from the Commissioner at the Mass Commission for the Blind. And finally, Dr. Anurag Gupta, who's the co-founder and CEO of Tembo Health. Tembo Health is a virtual medicine practice that uses technology to help patients in nursing homes get care in hard-to-access specialties. So again, welcome attendees, and a very warm welcome to our panelists. So let me start before we dig in with questions with a little bit of framing. And, just for the benefit of the audience here, this actually came out of a prep call that we had among the panelists. So when we talk about barriers to access in telehealth, the conversation sometimes seems to begin and end at questions of access to high-speed internet. And in fact, just the other day, there was an article in Modern Healthcare that I think appropriately referred to the digital divide as a new social determinant of health. But I think even if we could wave a magic wand and solve that problem tomorrow, I don't think we would all sort of declare victory and move on. As you all sort of cited to me, inequities in telehealth actually encompass a constellation of challenges, not only access to technology and devices, but also the opportunity to make use of that technology, the usability of those technologies for different populations, and various other sort of on-the-ground issues that affect different communities. So let's agree that, notwithstanding the emphasis on access in the title of this event, that all of those domains are in bounds for our conversation today. So with that, let me get started. I'd love to just start by inviting our panelists to do some level setting for the people listening in here today. From where you sit today, has widespread or wider spread, I suppose, use of telemedicine helped or hindered efforts to advance health equity? And I see David nodding his head, so why don't I put that question to him first?
Sure, and thank you. It's great to be here with everybody. So I would say both. It has both helped and hindered. And some of the ways that it's helped is that obviously it's expanded it for people and taken down barriers that existed previously. But then that raises other challenges of equity with do people have access to the internet? For people with disabilities that I'm familiar with in my domain, so many of them live at or below the poverty level. So there are real financial impacts there of, am I paying for my prescription or am I, paying my high-speed internet bill? So I think having access to the information superhighway is really the prerequisite for being able to get this telehealth. So while it raises opportunities and access in ways, in other ways, it kind of restricts it financially. And then the other piece too, I think to consider is when we're talking about equity, I like to think of it as equality and all of the different groups. If you look at people with disabilities, depending upon which definition of disability you're using, that's going to be somewhere between 12 and 20% of the entire population. In a state like Massachusetts, that equates to somewhere around 800,000 people to maybe even 1 million people, which oftentimes makes people with disabilities one of the largest minority groups, if not the largest minority group. So obviously, communities of color and economic disparities. So I think there's many different groups here. And I think it's a case-by-case basis when we're talking about this access and opportunity to telehealth.
Thanks, David. And Lee, let me ask you. I mean, you're sitting in a unique position in that you are right in the middle of one of the largest delivery system in the state. So from your perspective, what are you seeing? I mean, do you, as I said, is telehealth helping, hurting, mixed bag, too soon to tell?
So I'll start by saying, we knew we had disparities in certain areas with digital access to tools before, but I would say with telehealth, they're sort of exacerbated. So a couple examples I can give you is that our patient portal enrollment is, skewed in a way that doesn't reflect our underlying patient population. And why is that important? Because what we call patient gateway, it's sort of the door to a lot of other tools. So if you're not on gateway, you're not going to be able to access a bunch of other things. Gateway hasn't yet been translated in a ton of languages. So again, if you don't speak English, it's going to be really hard for you to access that tool. We already know from the year's experience that video visits in particular in telehealth are skewed in various geographic locations that kind of reflect different populations. So our experience has been that telehealth has not been used equally, through the pandemic. It definitely is a great resource to continue care, but video visits, our portal use, they're not equal. And I think that gets to your point about there's internet access, there's having the device, there is, is the tool available in your language? Do you know how to use the tool? So even if it's available in your language, are you digitally, I guess, literate, to be able to use all of that? So I think there's multiple different areas in which, it can be inequitable for patients to access.
Thank you. Let me turn virtually. It's so funny not to be in a room. Madeline, I'm curious, one of the things I think I read a statistic today. I'm not going to even quote it because I don't think I'm going to get it right, but I think it is safe and accurate to say that of all the specialties that have seen growth in use of telehealth, certainly behavioral health services have not only seen growth, but seem to be sustaining in ongoing use of telehealth during the pandemic. So I'm curious from where you sit, again, kind of with our fundamental question here, from where you sit right now, is telemedicine helping or hurting as it relates to equity for both the communities you serve, but also for the people with the conditions that you serve?
Well, I'm going to start by saying it depends on how we define telehealth. In our world, in community behavioral health, most of the time telehealth translates to audio only visits or services. So it's not even the audio video that, we're so used to hearing, and it's, it's the very first definition when we think about telehealth in our world. And most of what we have been seeing for the last year or so is that a lot of our individuals in our communities, as much as they want to connect, and yes, you are right, services have increased, access has increased. Again, it depends on how we're looking at access and how we're defining that. Because for us, it's the practice has been audio only services. A lot of our individuals, they don't have the infrastructure to support audio video. They don't have computers, they don't have internet, they don't, and even when they do, they don't know how to utilize those platforms. A lot of our individuals are, we do work with Black or brown and brown individuals, very marginalized populations. So our individuals are homeless or are transient, or they have a lot of needs. And like David was saying, a lot of them do debate whether I'm going to be, paying for food or paying utilities or navigating how am I going to pay my rent. So having access to the equipment needed to be able to connect with a provider, it's way at the bottom of that priority list. And a lot of them do have what we still know as the Obama phones. So that's the only way that we have to connect to them. And even so, a lot of the times it's still the traditional face-to-face. They are still coming into our clinics because they have no other way of connecting. And so that's what we're seeing a lot of.
Thank you so much. And I think that actually raises a really interesting kind of grounding point for this whole conversation, which, as I started, I noted that the growth in telemedicine has been so significant during the pandemic. So I feel like oftentimes we weigh against what feels like an impossible alternative, which is care via telemedicine in some form or fashion, as opposed to no care at all, versus comparing care via telemedicine with what we would want, our loved ones, our patients, our family members to experience. And it's a helpful point to point out that, for some of your folks, yes, they can have a telemedicine visit, but even in that context, it may be a suboptimal telemedicine visit because they're limited by their access to technology. You also raised a really interesting point that's a great segue to our last panelist here, which is even talking about what we mean when we're talking about telehealth can be complicated and can change the nature of the discussion. So Anurag, let me invite you to talk a little bit about Tembo, because I think what you are doing is actually somewhat different and might offer a different perspective on what telemedicine can or can't do to start leveling the playing field.
Thanks, Kelly, and good afternoon, everyone on the call. I think at Tembo Health, we're taking a slightly different approach to telemedicine or telehealth. Our mission is to really improve access and health outcomes for vulnerable populations. Our current focus is really on the senior population, so mostly Medicare, Medicaid population. And what we do is we partner with nursing homes to really leverage the infrastructure that they have to help them elevate the level of complexity of care and also the quality of care that they're able to achieve. For me, it was a very personal beginning. About 5 years ago, my own grandfather went into his first nursing home experience after multiple hospitalizations for various issues. And what was really sad and profound to me was that, we moved him into a nursing home out of my parents' home to have better healthcare, better access to care, better outcomes. But what we found was the complete inverse. He went from having, 5 specialty doctors that were managing his chronic conditions, 22 medications, his primary care, cardiologist, pulmonologist, neurologist, and endocrinologist, to having 0. None of his physicians traveled to nursing homes. And with his frailty and mobility at the age of 90, he was not able to go to the doctor's offices, which is a big reason for putting him in the nursing home. So he went literally from having 5 doctors to 0. And I felt like that was a huge problem. And I couldn't find any nursing homes that had access to cardiologists and pulmonologists and so forth. We found him obviously a replacement primary care physician. But really, our mission at Tembo is to augment the care that seniors, basically are not receiving in these senior communities and nursing homes.
Great. So let me sort of drill down a little bit here, because as I said, we started by sort of scoping this challenge a little more broadly than, as I said, the title of this event might suggest. So we talked about it encompassing a lot of different things, not just access to the technology or devices, but usability and the like. I'm curious to hear from all of you, what keeps you up at night as people who have responsibility or feel accountability to populations? Is there, in that spectrum from access to broadband to sort of usability of the product, what causes you the greatest concern? And I'm going to start with Lee for this one.
A hard question to answer, Kelly, I'll be honest. There's a lot of barriers that we've been working towards. I mean, I guess I'll start by saying, at Mass General Brigham, we have a lot of initiatives to kind of try to close those gaps, so I feel like there's so much work to be done. That kind of is what keeps me up at night. And we're trying to work as fast as we can. We're trying to, translate our patient portal, create programs to give people either iPads and or internet access if they need to. We're trying to create a digital, access coordinator workforce to help them learn how to use these tools. I mean, we're trying to stand up programs to, really close all the gaps, but there are a lot of layers and, potentially a lot of things to try to, narrow and give people the opportunity to be able to equitably access, all the tools that we have. So maybe some of these disparities can decrease.
So it sounds like the answer is all of the above keeps me up at night. So I'm sure you're not alone. Madeline, do you have any perspective on this that's different, or is there a particular, as you think about bringing what we hope are the benefits of telemedicine to the population you serve, what feels like the highest priority if you could only do one thing? Which I realize, I'm sorry, I feel like I'm asking these like challenge questions, rating and scoring, but I'd just be curious to hear, if you had to pick something to lean in on this week, what it might be.
That's the $1 million question, and it has 1,000,001 answer. Again, it's how do we look at access? One of the most visible challenges that we all face is not just the equipment. I think and again, I keep saying my world, community behavioral health, and the population that we serve. It's a matter of access to providers with language proficiency, with that are culturally sensitive and competent, that are able to provide individuals, again, like David was mentioning, with disabilities or with specific needs, the services that they need. So it's so much more than that. And us trying to address some of those things at the same time, because we have to. There's no way that we can address one without not addressing the other. It gets significantly challenging every day. I think that we are going in the right direction as a state. We're certainly looking a lot more and paying a lot more attention to issues of access and addressing inequities and disparities. And certainly a lot more is being done when it comes to actually providing different avenues to increase the use of telehealth by way of equipment or internet or phones. But that's not just the only thing that it's getting in the way. It's all of these other things as well, and that it takes so much more to address, and we need so much more support to be able to figure those out and address them.
So it definitely sounds like, as I think you've all called out, that the technology is just the first domino that needs to fall, and then 1 million dominoes fall from there. I mean, interestingly, in some of the work we've done at the HPC related to telemedicine, we've heard some feedback that was incredibly interesting to me, probably second nature to you, that, for example, one of the barriers to for some populations to use technology is not the technology itself, it's finding a private place to have a doctor's appointment on the phone or on a laptop. Everything is in place technologically, but it's hard to do that with your kids or your parents or whoever running around. David, I'm wondering, from your perspective, like, what are some of the real world barriers that you find with your population, things that might not be obvious limitations, but most definitely are in real life?
Yeah, great question. So to me, it runs the gamut, and start with the big picture. So it's challenging from a public policy point of view to be able to put policies in place that consider everybody, right? That's the goal, is to make sure that when we do put policies in place, it impacts everybody equally. But then how do you make that on a case-by-case basis? We have 25,000 consumers, for example, enrolled with our agency, and show me 25,000 people with blindness and visual impairments, and I'll show you 25,000 separate instances of that, and everybody's so unique. So the inherent challenge of trying to scale public programming to fit every individual in a way that is equal for everybody. That's the inherent kind of really big picture challenge. Then when you boil down to the micro level, it's things like having communication access that the Americans with Disabilities Act, which is the preeminent federal disability anti-discrimination law, to ensure that there is effective communication access for people who are deaf and hard of hearing, that whatever apps are being used are screen reader friendly, so that my consumers can use JAWS or Zoom text to be able to read the screen and get into the app. Because all of these apps and all of these technologies are great, but if you can't access them, and if your method of communication isn't facilitated by them, then they really aren't useful to a large segment of our population. And obviously we don't want that. We want everybody to be included. That's the very basis of equality, right? So I hope that gives you a range of, we're working on these bigger policy things, and then it's really case by case, and just making sure that people have access to opportunities and are really being treated as equally as possible.
Yeah, it's funny as you say that. One of the things that strikes me from all of this conversation is that, we spent a lot of time focusing on the technology, and rightly so. We are MassChallenge Health Tech here, and that's kind of what our thing is. At the same time, we know that in the healthcare delivery system, there are issues of implicit bias that manifest themselves in all forms of treatment. And when I think about technology, right, oftentimes the gateway, that's sort of the access point people have, certainly to healthcare technology, is through the healthcare delivery system. So I'm really interested to hear from all of you if you think that there are implicit biases that exist in the fundamental question of, and I'm using air quotes here, who is quote unquote appropriate for telehealth. And I'm going to start with Anurag. And as I said, it's an interesting question to pose to you, but I think, oftentimes when we talk about seniors, there are assumptions made about tech savviness or lack thereof. So I'm curious if you think that those biases are real, and have some thoughts as to what we can do about them.
Yeah, thank you. I think it's very real. We kind of cheat at Tembo Health in terms of our partnership model with nursing communities. So when we partner with a community, we leverage their infrastructure. That includes putting in a single telemedicine cart that can be, wheeled across the facility from room to room. We'll employ the nurses and technicians who work in the building who are already there 24/7 to help facilitate the visits. So not only are they bringing the cart to the bedside, but they're turning on, the video platform, they're turning on the cart, they're going to obtain vital signs for us in real time from the patient. We have things like a digital stethoscope, digital otoscope, dermoscope, digital EKGs that the nurse can then use so that our doctors can not only get a full history, but also get a very robust physical exam. And so in that way, for the patient, it's almost as easy as watching TV. They don't have to really have any tech savviness or personal infrastructure or knowledge. It gets a little bit more complex when we have seniors with dementia and so forth. And to overcome that, what we've recently done, well, almost a year ago now, is we've actually built our platforms that we're able to invite family members to join every single session live as well, so that the family member can really participate in a meaningful way. That's awesome. Thanks, David. And it just really allows us to make sure that everyone is bought into the care plan. We have shared decision-making with the key stakeholders between, the nursing staff, the resident, and the family member. But we often get questions of, when is Tembo going to expand to seniors at home? And that's when we think about those barriers. We've become almost spoiled in the fact that when we were working with nursing homes, our clinicians, in my opinion, and from what I've heard from our clinicians, is when they're working at Tembo, they actually have superior access to data compared to even when they see patients in a live clinical setting, because we're feeding them, we have all these integrations with the EHR, we have the nurses who are telling us how the patients are doing in between visits, we now have family members joining the visits. You never get that much information holistically about a single patient's case when you're seeing them in a clinic. It just doesn't happen. And so, as we look towards future growth and continue to serve the senior population, we're going to have to think really hard about, how do we overcome these types of barriers in a home setting. And frankly, right now, we are continuing our focus on partnering with senior communities for the time being.
Let me ask a similar question to Madeline. As I said, I think when I think about, access to technology through the delivery system, as I said, there's always this lens of somebody is making a judgment to decide Mr. A, yeah, he'd be great for this type of intervention versus Mrs. B or whoever. I'm curious as to how that plays. Well, first of all, if you buy that proposition, and if you don't, by all means, challenge it. But also, what do we do about it? How do we encourage people if that is an issue? How do we encourage the people who function as the gateways to technology for folks? How do we get them to think differently?
It's a challenge. It's a challenge. A lot of people don't want to. They don't feel comfortable. So it's not just, it's so much more than having the access. It's about level of comfort. It's about something new, and then moving away from what they know and what they feel comfortable doing. It's also it's just different than not having that physical contact with that provider. It's just a game changer. So it's trying to reframe all of it. How services are being provided, how confidentiality plays into this whole thing, the environment where they're at, what's around them. It's for us, it's certainly been a challenge. On the patient side of things, and also on the actual systems and platforms. A lot of these systems and platforms are very medically oriented, or they've been designed for this specific level of care, and doesn't quite fit with what we do, and doesn't quite meet all of the needs of our level of care. So it's also trying to navigate those waters and making sure that that we're not fitting, how do they say, a round peg in a square hole, or vice versa, something like that. So it's, again, multiple things playing into it. I don't know if that answered your question, but those are the things that come to mind.
Yeah, it does, because and I think it actually broadens the question beyond whatever assumptions a provider might be making about who's appropriate, also starting to get into questions of how patients themselves perceive their relationship with the technology.
Absolutely.
And let me actually put that question to Lee. I mean, obviously you described all of the different activities that you're doing to try to sort of level the playing field in telemedicine. I'd be curious to hear, when you think about the populations that maybe aren't taking up the technology as quickly, what are their perceptions of the technology? Do they, and I realize you can't, generalize across a broad and diverse community, but I'd be interested in understanding, even if you can solve people's technology problems or their privacy problems in their home, how are you finding that people just think about telehealth in terms of their relationship to their care?
So it's a really interesting question. And I just want to make two comments before I forget. So Tempo Health, I think involving family members and things is awesome. And we are, a lot of our hospitals are looking at, giving patients some kind of device so that they can, FaceTime or, whatever, Skype with their family members, because we have restricted visitor policies with COVID. But the flip side of that is we found that some family members can't access that. So it doesn't help to give the patient that technology if the family member doesn't have that technology. And so again, you sort of end up with this inequitable place. And I forgot what the second one was going to be, but I think I actually don't know how patients are going to perceive this. One of the things that we're trying to learn with these pilots that we're doing, we've talked to people across the country, and a lot of places will give, Chromebooks or devices for the patient to keep and try to provide them internet for, a year or something like that. The program that we're developing is a little different than that, where we're trying to give them the technology for a shorter period of time. And we hope that patients will adopt this, but that's one of the things we're trying to learn is, do patients adopt this? Does it fill a gap? Are there certain patients that, this will work for and other patients that it won't work for? And I think some of the things that we're thinking about, and I think this is what David is getting at, is there certain patients who, may need a lot more training, certain patients who may not need as much training. And there's a wide variety of you just need the device? Do you just need the internet? Do you need both? Or do you need training on the tool, right? So we're trying to figure out how do we meet those needs and those gaps? And then as Madeline was saying, then you have all the other things too, are you comfortable with your provider? Do they speak your language? That kind of thing. And again, we sort of, realize there are barriers kind of at every level. So again, getting to the patient portal, I can translate the patient portal, but then if my patient doesn't speak English and they write to me in a different language, how do I navigate that, right? So there are just so many layers to giving people equitable access. And I don't know if that answers your question. I don't know how patients are going to perceive us, offering them device and internet. We're also looking at trying to get family members, devices and internet to, again, keep in touch. So it's one of the things that, we're hoping to learn through the pilots that we're trying to stand up, this spring and through the next year or so to understand, can we close these gaps in a successful way?
That's terrific. And I'm going to build on that last question and take a question from I was about to say the audience. As I said, it's so strange on Zoom when I can't see people, but it comes from a startup in the MassChallenge cohort, and it speaks to this issue of how people who are trying to develop these technologies in an inclusive way can actually try to glean some of the insights you're trying to glean right now. Let me read the question. It says, we'd like to innovate inclusively, but struggle to understand the way to do that while also trying to commercialize their business. How can we prioritize where to focus? If we try to meet all of the needs, we may never get to market. So nobody will benefit, right? Because no product will get out there. But if we don't do enough, then we might inadvertently contribute to innovation-generated inequity. It's a really good question. I wish I'd thought of it myself. So, but I'm going to actually put that to Anurag, because I think it's a really interesting question. Like, what advice would you give to these entrepreneurs about how to be part of the solution, not contributors to the problem, but still, succeed in starting their businesses?
Yeah, I think it's a great question. And I love hearing things like this coming from other MassChallenge companies. For us, it's really thinking about, are you a mission-based venture, or a traditional for-profit venture? I mean, at Tembo, we're both, right? We have a mission that we're serving, and we're using business and entrepreneurship to accomplish that. But I think it's really important, at the onset, to create your focus on who you want to help, why you want to help them, and then figure out the solutions to get there. For us, it's really about improving access to seniors, and then also improving outcomes. And that's our North Star in terms of every decision we make. Does it improve access, and does it also contribute to our ability to improve outcomes? And I think just starting with that basic thesis will really help guide other ventures to deciding, what decisions to take and the path to take. So kind of a general answer, I suppose. Sorry, but
no, but I think what I took away from your answer is that fundamentally you need to decide what it is that you're trying to achieve and stick to that. And then you'll be okay, and let that be your North Star. But I'm going to pose a similar question to David, because it's with a slightly different angle, because I know from prior conversations you have opinions on the market for digital health and telehealth solutions, for example, within the disability community. So if you were speaking to the person who posed this question about how to balance a desire to innovate inclusively and not be part of the problem with a desire to get a business going, what would you tell this person?
Technology can be a force multiplier and really level the playing field for people with disabilities of all prevalence types. And I think of these devices, right? They turn us all into smart people, whether we're smart or not, because the answer is just a couple of clicks away. But if you can solve for people with disabilities, in other words, if you can produce a device or a machine or an app, whatever the case may be, for all of the various prevalence types. So for people with hearing challenges, vision challenges, intellectual challenges, mobility challenges, if you can provide that device, then you've got something on your hands that now is available to everyone, right? What is the genius of these devices? It's that there's no direction manual that comes with it. A couple of clicks and, people as young as 3 and 4 years old are all of a sudden surfing and using these apps and everything else. So I think that's the key, is making something that is available to all. And availability and usability have high correlations to accessibility. Now, they're not always the same thing, but if you can make something that's easy to use, that's available to everybody, that's a good thing. The market for people with disabilities is about $500 billion worth of spending power, by the way. We have data that backs that up. So again, somewhere between 12 and 20% of the general population. If you said to any business owner or entrepreneur, hey, would you like to pick up an extra 10 or 20% market share? They're all going to raise their hand and say, sure, I want to. So I think the more accessible and available and usable you can make your product or service, I think the better product you're going to have, the more that's going to help people with disabilities, and just the better that is for society in general.
Thanks, Dave. See, I knew you'd like that question. So let me pause, because we're getting near the end, and we've got a lot of really good questions in the chat and in the Q&A. But I always, at this point, like to offer my, I'm going to make somebody all powerful here. And I think just because I can see right now in her, she's in my line of sight, I'm going to make Madeline all powerful in this moment. And, taking a step back here and thinking, here we've got technology. We've got this telemedicine technology that can take forms that are closer to what Anurag's company's doing, or virtual visits, whatever it is. If you could, sort of wave a wand and do like where do you think that telemedicine, telehealth technology could actually make care better? What would you want it to do to make care better? And when I say better, I don't mean just get back from whatever COVID depths we're in to the baseline. I mean better than it was, 2 years ago. What would you like to do if you were, how would you like to leverage technology if you were fully empowered to do so?
Wow. Language, it's a big thing. And the ability to communicate in the individual's language, it's huge. And if we were to have a system that would facilitate some of that, that would be huge, especially for the communities that we serve. And then that speaks to also making sure that you provide the level of access that they need by way of providers and by way of language and culture and taking all of those things. So if I could pick the one, I would pick that one. I would pick something that had to do with language and facilitating that level of communication between that provider and that patient. Yeah.
So it's a great segue into one of the Q&As, because, to me, it's a really interesting answer, because speaking for myself, it's so easy to try to overthink and try to come up with complex solutions where there's something very fundamental about being able to communicate in somebody's preferred language and understand their culture. So thank you for that. So we've got about a little less than 15 minutes left, and I'm going to pivot here to some questions from the audience. So I will take turns dishing these out, or if people are particularly enthusiastic and want to answer them, by all means. So maybe this is a good way to build on this. There's a question that says, we tend to think about big shifts, but this person's curious about the smaller things that have had great impacts. Are there smaller shifts in the technology landscape that you've seen in your environment that have had larger than expected impact? And maybe I'll pass that one to Lee.
I'm not sure I can think of anything specific that I have data on, but to Madeline's point, we've really made an effort to translate our materials into certain languages, and sort of it is becoming kind of core to whatever we do. So anything, digital tool, is it translated? Is it available in Spanish at least, or that kind of thing. And I think, that may be what I could think of in terms of, maybe you think of it as a little thing. It's actually a huge amount of work, to be perfectly honest, to do that, because every time you change something, you have to think about a couple different layers. But that's kind of what comes to mind is, it's not a huge thing in like terms of like a technology build, but makes it much more accessible for those patients immediately, and something that they could probably not access otherwise. I'm not sure if that answers your question exactly, but that's sort of what comes to top of mind.
Yeah. So let me, as I said, I apologize, I'm scrolling and reading and talking at the same time. Another question from the audience is about measurement and how we should be thinking about how we're doing, whether it's in terms of equity or accessibility, so that we can see progress. So you can imagine if we're speaking to an entrepreneur or potentially implementing a technology in our own space, like what are the data that we should be collecting from the beginning? And Anurag, I don't know if you have a thought on that.
Yeah, we're self-proclaimed data geeks at Tembo Health. we feel like data is critical, and it's really important to measure outcomes, because if you don't measure things, you can't improve things. You have to understand the baseline. You have to have a hypothesis, and you have to see, are you tracking in the right direction, the wrong direction? And it's totally fine to track in the wrong direction, because that's how you problem solve, and that's how you identify things that go wrong. So, we work really hard at Tembo to have dashboards that are internal for our team, but also external for our clients, being the nursing homes and the primary care physicians that we partner with. And we look at all sorts of things, so in a given nursing home, are we treating, what percent of the population in the AIDS facility are we treating for psychiatry versus cardiology versus neurology? And we can kind of look at those numbers. We can say, like, well, we know nationally that 80% of seniors have some behavioral health condition. In most of our communities, we're treating about 65% of residents for behavioral health issues. So that kind of tracks very well with the national numbers. But we may have one community where we're only treating 40%, and then that allows us to have a conversation and say, like, why are we not helping the residents that we can and should be helping with their behavioral health issues? Is it because it could be a number of reasons. And then we try to track a lot of other things, like, in behavioral health, for example, we look at total number of medications, total number of antipsychotics. Our goal is to reduce the number of psychiatric medications that seniors are on. And then we look at ER transfer rates, hospitalization, overall longevity. Are people actually living longer because they're having better access to proactive specialty care, and so forth. We still need lots of data to make any judgments on that, but those are the types of things that we're tracking.
So let me, oh, go ahead.
Sorry, I just also want to add, when you talk about equity, I think it's also important, though, to think about race and ethnicity and language and those kinds of things. So, I love data as well. And I think, the disparities that we see are very stark in our data, and they're not disputable, basically, but you have to break it down in a certain way, or by disabilities or whatever it is, in order to see those discrepancies. So, we do a lot of work to look at it by, the things I just mentioned, so that we know, are we just improving things only for a certain population of patients, as opposed to across the board. And we have seen disparities that are different depending on race, ethnicity, and language as well.
Thanks for adding that, because I think it's an incredibly important point. Another question from the audience that I'm going to put to this entire group, and whoever wants to jump in first should feel free. Somebody poses the question, are there industry leaders who come to mind when it comes to addressing health equity, particularly through technology? And so I think another way to put that is, are there organizations out there that you secretly envy just a little bit because they're doing it really, really well? Anybody feel free to jump in, or I can call on somebody.
Yeah, I'll start. So we gave an award this past year, to Always Health Partners, because they do such a great job of being ahead of the curve and seeking out challenges and then really trying to solve for them. It's never going to be perfect. We know that, but that doesn't mean you don't try to be perfect, right? For example, with people with disabilities and accessible websites, for example, people often ask me, well, what's the most accessible website? The most accessible website is a white screen with one or two lines of text on it that is fully integrated into JAWS. That's not feasible for a lot of websites, right? So it's varying degrees of accessibility for people with disabilities. And that often equates to other populations as well, because many other populations share characteristics of the other. You can be a woman and a person of color and be a person with a disability at the same time. So these are not necessarily mutually exclusive concepts here. There's a lot of overlap. And again, I credit Always with being able to seek out those challenges and trying to solve for them. They're really a leader in Massachusetts.
So it sounds like your definition of an organization to envy is one that's willing to get in the game and get started. Anybody else? Is there anybody else has anybody they want to cite as just a bit of an inspiration? If not, we can move on. Okay, so we have about 4 minutes left here, so it's probably time to wrap up. Let me tell you what I think I've heard today. For the benefit of the audience. I think what we've heard is that in general, in our experience today, that telemedicine as it stands today is a bit of a mixed bag. I mean, unquestionably has been a help in certain circumstances, but we still have a long way to go to make sure that we are not, as I said, exacerbating problems or creating new ones through the use of the technology. I think what I've heard from all of you is that that in order to get to that next level of effectiveness, we've got to be doing a few things. Number one is measuring, being data geeks, but to Lee's point, being data geeks with a very powerful overlay of race, ethnicity, language, disability, so that we understand exactly what's going on and can make course corrections as appropriate. I think the other really important thing I heard today, particularly from Madeline, is that just this incredibly important need to understand sort of understand and solve for the fundamental barriers that prevent the populations from making use of technology. So on one hand, I think we've heard very loud and clear, until you address the technology barriers, until you address access to devices, until you address fundamental things like, can any of these tools connect with people in a language they understand, we won't get very far. But I think the thing that I've heard from all of you is, that this is really complicated, that there are multifactorial issues at play, and that we're still learning. I mean, I think I started this presentation by saying we've had this really, unusual, very rapid experiment in lots and lots and lots of telehealth. I think we should remind ourselves that we're only a year into it. And so I think as much as we want solutions, it seems that it might be early to be drawing too many conclusions, and that the name of the game for now is to just continue to learn, to continue to gather information. So with that, let me say first and foremost, thank you to all of our panelists for jumping into this with us and providing another thumbs up from David. So thank you all very, very much for joining the conversation. We really, really appreciate it. I'd also like to thank everybody in the audience for joining and for all of the good questions. I'm sorry we couldn't answer more of them. There will be upcoming events continuing in this theme of health equity. There should be in the chat an opportunity to sign up for the next ones. There will also be a Zoom survey that can help, they can offer you the opportunity to give us feedback to help make these events more valuable to you. So with that, let me just say thank you again, and we hope you will come back and join us for the next event. Thank you.